Okay, guys, I want to touch on a couple things today real quick because I know today is the first day we're actually starting to follow you and hold you accountable to the program. And one thing is if you guys are still experiencing the keto flu, which is you're a little lethargic, moody, headaches, still having severe hunger pains, there's a good chance that you are not getting your carbs low enough. And you need to start counting total carbs instead of net carbs. And you need to make sure that every single day that you're getting those carbs down below 20 in order to get your body into ketosis or fat burning mode. So you have got to get it down to that. Now, if you are following that legitimately, then we probably need to add some fasting, intermittent fasting to your protocol because you're just more insulin resistant. That's how I was. So it's something that I personally have done, and it's not that big a deal. We can get you back on the course and get you past those hunger pains. And something else you can do with those hunger pains is to take in sodium. And what I would do is those hunger pains will come in waves, and they typically last 2 to 5 minutes, and they pass, they go on. But if you are getting hungry and they're just overwhelming, what you can do is you can take a little bit of MCT oil, coconut oil, or a little bit of salt, like a quarter teaspoon of salt, and that will help with the hunger pains. And it will not kick you out of ketosis. And if you are fasting, it will kind of break the fast a little bit, but it's very short term because you're still in ketosis, because the fat or the MCT oils immediately turn into ketones for energy for the brain. So you actually probably feel better. But it's not going to kick you out of the fast very long, just for maybe 30 minutes or so. So cut those carbs, and if you are legitimate, of course, talk to me. We may have to start doing fasting, intermittent fasting. We'll start out 12 hours and up. Some of you guys are already doing that, but for those who aren't, that's what we'll add. Diet soda. I used to drink diet soda till last Friday. So I would drink diet soda when I would get hungry sometimes. And I came across a study, and I'm trying to verify, because I heard it from a doctor in a lecture. So I'm trying to actually find the actual study. But there was a study of 24 people who they weren't on any type of diet program. They were just all drinking soda, and nothing changed in their exercise or diet program. But when they cut out soda, they lost 19 pounds. Now, I'm not sure how much time that was, because I'm trying to find the study, and he didn't say in the lecture. But just by cutting out diet soda, they lost 19 pounds. So I know for some people, we know in research that it affects their insulin levels a lot more than others. But what it will definitely do is it will cause more cravings, and it does stop your weight loss at minimum short term, sometimes a little bit longer. So it can actually help prevent you from losing weight. So I would suggest cutting out any type of diet drinks, diet sodas, anything that has a sweetener like erythritol or Splenda, something like that. If it's every once in a while, but not regularly, because I actually personally got to the point where I was dependent on it regularly. I was drinking almost a diet soda every day. Something else I want to talk to you about outside, just the hunger pains and so on, is about supplementation. And none of these supplements are necessarily have to do with the program or protocol. Most of these supplements are just because we know that the vast majority of the American population are deficient. And what I mean by vast majority, 70 to 80+% of the population are deficient in these supplements. So, and these are very important. We need to have these in our diet. The first one we'll talk about is magnesium. Magnesium is good for the gut. If you have constipation, it helps with that. You need it for your nervous system, for energy, it's anti-inflammatory, and typically I think the dose is 240 milligrams a day. Whatever the recommended daily allowance is what you need to take. But over 80% of the population is deficient. Now, for all these we're going to discuss, we can do blood work on if you want to find out. I've done it in many cases, like with D3 and so on, but we can do that. But most people we know are low. Potassium. It's important for your nervous system, your fluid balance. It actually helps you pull extra water weight off. muscle and heart contraction. Blood pressure, helps with lowering your blood pressure, helps with kidney function. It's extremely important, and most people don't get enough of it. And they say you can take up to about 1,000. Most doctors say up to 1,000 milligrams a day. You can get, if you get way too much, it's going to affect your, like, give you a heart murmur, affect your heart. But it's kind of difficult to you'd have to purposely get up that high unless you're eating a lot of avocado. So just look at the potassium, and I think you need to be around like 4,000 milligrams of potassium a day. It also offsets sodium, helps with that if you have issues with sodium. Well, the next one is sodium, because you need sodium in your diet. It affects your nervous system. You need sodium to stay alive. And my personal experience was I was eating all whole foods, eating nothing processed, drinking a lot of water. I got to the point where I was adding no salt. I've never added salt to my diet ever in my life. And I started getting dizzy, lightheaded, and ended up going to the emergency room thinking it's a possible heart attack, what's going on. And what it was, after 6 hours of blood work and labs, the cardiovascular surgeon came in and said, so I'm going to tell you to do something that I haven't told very many people. He said, your sodium is low, and it says you're dehydrated. I said, well, I drink, minimum at that time, probably 3/4 of a gallon of water a day. And he said, well, water goes where sodium goes. And if your sodium is low, that's why it looks like you're dehydrated. So he said, you need to, so I'm going to prescribe, and Jennifer said the same thing, I'm going to prescribe salt. So I started taking about 1/4 teaspoon of salt a day. And I don't hold water and that kind of stuff, but all the dizziness and lightheadedness went away, had more energy, just felt 100% better. Literally almost immediately, within like 30 minutes. So you need to have salt, but you can also have too much of it. So keep it around 2,300 milligrams a day, and you're usually going to be okay, but you definitely need it. L-glutamine for the gut. It helps with it's a barrier between the acid and other tissues in the gut and lining, and it helps tremendously, like with IBS and things like that. I used to have to take a lot of probiotics, and just have for a long time. I started taking L-glutamine, all my gut issues went away, and I don't have to take probiotics anymore, and it's a lot cheaper. I buy a 2-pound bag off of Amazon for like $33, and it lasts me for months. So L-glutamine is very important. It's an amino acid. You need it, especially if you're having issues with like constipation, because if you're usually eating a lot of high fiber, a lot of fruit, things like that, and you go to a high protein diet, you may have some constipation issues in the beginning. That's where magnesium will help, but also L-glutamine will help. And those issues pass. It only takes a few days. But if you do have a constipation issue, those 2 supplements will help with that. You can also take a stool softener or whatever. Fish oil. And you've all heard that 1,000 times. I take it. We need it. We need the omega-3s. So another thing is collagen. Now, I didn't start taking collagen until off and on for a couple times. I saw immediately differences in my nails. They grow a lot faster. My beard grew faster. My hair grew faster. My nails were thicker. It was irritating because I was having to cut and shave more often. But I've come across the research where it helps with the liver. In order to heal the liver, you got to have higher levels of collagen, all the connective tissues and muscle. I've noticed since I've started taking collagen that I don't get sore. And that's actually, for me, it's pretty amazing, especially on leg days. I would be sore for a few days because I'll push it pretty hard, and I just don't get sore like that anymore. Of course, my nails grow faster. Got to cut my hair once a week, all that kind of stuff. But it's definitely beneficial in helping connect the tissue with your skin aesthetics, especially as you're fasting. You're worried about excess skin. It's going to help give you that flexibility back. Malleability, I guess, back to the skin. So collagen, it's almost everyone who's over, I think, in mid-30s is not getting enough collagen. And where you can get collagen in your diet is usually through the connective tissue in the meats and organ meats, but we don't eat that anymore. D3, almost everyone is deficient in D3, almost 100%, because the way you get D3 is there's only two ways: either through the sun or through your diet. And in order to get it through the sun, you have to be out in the sun in this part of the country between like 12 and 2 o'clock naked for what, 15, 30 minutes. I forget the actual amount, but it's almost impossible. And the darker your skin is, the less absorption you're going to be able to, the less you're going to be able to absorb it. And so you're even more deficient. Like the African American community is actually much higher deficiency of vitamin D because of the melanin in their skin. So the only way you can get it is through your diet. And the way you normally get it through your diet, we used to, is through organ meats, liver, brain, meats like that. That's where we would get the K2. Well, we don't eat those anymore. I've tried to even find them, and it's hard to even find it. So the best way to do it is supplement with it. And that is, and what vitamin D does, helps with, of course, energy, helps fight disease, reduces depression, helps with weight loss a little bit. And when you combine it with K2, which is what I'm about to talk about, and you can only get that through organ meats. Yeah, and some vegetables or plants, but mostly through organ meats. It can really, even though you don't see it happening in your body, like D3 and K2 together, what they do, and you look online, look up any of the research, you're going to see it's everywhere. And I've seen the research, and I've also followed a couple of cardiovascular surgeons who went in and did the CSC test to check their arteries, and was checking the age of their arteries and see how clogged they were. And what D3 and K2 will do is it will tell your body what to do with the calcium. So if you're insufficient or deficient on K2 and D3, the calcium that you eat just floats through your body, through your blood vessels, and it doesn't know where to go. And you have to have K2 to tell it where to go. So D3 and K2 will prevent cardiovascular disease, the calcium buildup in your arteries. It also prevents osteoporosis, especially in primary and females, because again, it tells the body where to do that calcium and deposit it into the bones. It also helps with dental health. So anything to do with the bones. It also reverses or can prevent kidney stones and actually reverse them. And like some of the two cardiovascular surgeons or doctors, it actually reversed the age of their arteries from 78 down to 51. He was 54, I think, at the time. Was following the FDA guidelines. Was thin, in good shape, and thought he was doing everything right until he went and did the test and found out, his arteries were about 15 years older than what he was, and he was headed toward an event. Started D3K2 9 months later. His arteries had declined down to 51 years of age, which was younger than he actually is. So we have all that research. So also with kidney stones, if you have a history of kidney stones, some people, they say when they start taking D3K2, it creates kidney stones. Well, it doesn't. What it actually does, it starts to dissolve, just like the plaque in the arteries. It will dissolve it and remove it over time. It does the same thing with kidney stones. And what happens in many cases is as your kidney stone builds up layer after layer, well, the D3K2 starts to remove it, but it doesn't remove it the exact same way. So the kidney stone may actually break loose, but it's still dissolving it, and it just happens to break loose earlier than when it was built up, in reverse of how it was built up. But so D3K2 is very important, especially with kidney stones and cardiovascular disease. So if you guys have any questions, again, none of these are required. We don't sell any of these, but I know based on research that most of America is deficient because we're not getting it in our diet. And if you're deficient, these things can help and make a difference. So if you have any questions, hit me up. But definitely watch your carbs. We're going to start doing 3 workouts a week, a body workout, a full body workout, and we'll change up in the future. So get ready. This thing is really getting started.